Thanks again for joining me for Conversations on a Bench, a national 24-hour event put on by Citygate, our Association of Rescue Missions, to talk about homelessness, about addiction, mental health, things that affect the people in poverty in our area. And one of the things that's very important to us at Midland's Open Door is to really follow God's call on us to be hospitable. And something that came to mind today was Proverbs 31:8 that says, "Speak up for those who will have no voice, for the justice of all who are dispossessed. Speak up, judge righteously, and defend the cause of the oppressed and the needy." And I'm so thankful for the partners that we have here in town that do that. And I'd like to welcome Joe Coffey on. Joe is with Home to Stay. So good to see you.
Good to see you too.
Have a seat, Joe.
Thanks for inviting me.
Well, thanks for coming. I have something for you. I have a pair of open door socks for you.
Thank you. Well, I am famous for my sock game.
Well, so add those to your list. So, Joe, tell me a little bit about what you do at Home to Stay and how we partner together.
Absolutely. So, Home to Stay is the HARA agency here in Midland County. So, HARA is the Housing Assessment and Resource Agency, and that is a designation that comes through the state of Michigan, and it's even going back further, comes through HUD. And so that means that we are the central point of intake for families and individuals who are experiencing homelessness or at high risk for experiencing homelessness here in Midland County. And we work together with our local shelter and many other agencies to get folks into what's known as the coordinated entry system. And that system helps the agencies and the local planning body in the county determine who needs services, at what level they need services, and how they should be prioritized. And so an example of that would be if somebody is chronically homeless and they have children with them, they would be prioritized a little bit higher than someone who is having a first-time experience and is a single individual.
And I know that your funding runs, what, October to October?
October to October.
Or whatever. So I know that we, at times together, will have some struggles with people who are like late in the summer, early in the fall. And they'll say things like, Home to Stay can't help me. Is that really true?
I'm going to say not exactly.
There we go.
So what we can do certainly is, first and foremost, provide any of our outreach services. So our outreach services include things like food. So we have two types of food services that we have. We have what's called a tote, and we have a bag. The food bag is meant for people who are living in places that aren't necessarily considered habitable. So if someone
Like what?
so if someone was living in their car, maybe they're living in a tent and they don't have electricity, or they don't have something to open a can or microwave things. So that's more ready to eat food. And then we have in our totes for folks who are experiencing sort of that at-risk piece. And maybe this food is going to be something that they don't have to spend money on, and they can stabilize their housing a little bit. So that's one thing. We also have a vital statistics program. The vital statistics program is so important because, as you know, many of the people that we serve have left whatever housing situation they were in, oftentimes not by their own choice, either because they're fleeing something or they were asked to leave by the people who own the property they were at. And when people leave like that, they don't always leave with everything they need. So things like your birth certificate, your social security card, those sort of things sometimes get left behind in the hurry to vacate. And so folks can come to Home to Stay. We can help them get a birth certificate regardless of what state they were born in. And that process is really complicated.
I know.
And I'm always amazed at how complicated the process seems to be for me as someone who's not in crisis, and it's not my birth certificate that I'm trying to get. So if you think about that from the perspective of trying to do that on your own, if you're living in a tent, if you're in crisis, if you're in fear, if you're trying to provide for your children's food, it's just overwhelming, right? And so that ability to get access to a birth certificate and have somebody walk you through that process and pay for it opens up a lot of other avenues. The new thing that we've offered this year that I'm so excited about, and I know you have clients who've accessed, is our post office box program. So, as you know, the United Way held some listening sessions with the community earlier this year. And one of the things that came out of that was this idea that there were some obstacles to accessing some services in our county. And so Home to Stay held 3 more kind of follow-up sessions with your clients, our clients, and clients over at Shelter House, and said, tell us about these obstacles. What are they? And one of them that came up was that folks who are homeless don't have an address.
Yep.
And not having a permanent address in Midland County was creating an obstacle. So, you know, kind of worked with all of our community partners to come up with a plan, and we were able to launch this post office box program where folks can come, they can get this post office box for 6 months. It's paid for, and then they have an immediate address in Midland County that opens up the sort of access to services. Other outreach programs that we have are our furniture program, our appliance program. Um, but the bigger question, I think, and kind of what you're asking is about, can we pay for rent when we get to the end of the fiscal year? And the reality is that yes, we sometimes can, and sometimes we're not able to. Sometimes we have to help folks access other resources that are available in the community, at least temporarily, because we have to prioritize folks. We have to place, chronic families or chronic youth, um, and go through that process to make sure that, people are being equitably treated, and getting kind of the same level of service regardless of where they're entering that coordinated entry system.
Well, and one of the things that Kim and I were talking about was that the idea of low income housing has grown in cost. So now low income housing is supposed to be at about the $1,500 a month rate. And that is very unreachable for a lot of people. And that while we're glad that the house we own has increased in value, that it does have a trickle down effect, and that some of our friends end up living in very uninhabitable places. Just talking today with someone who is living in a storage unit because that is more affordable.
Yeah.
And, we don't want to see that happen. And we're very thankful for places like Home to Stay who can kind of fill that gap. And, the question I have is, what do you think is the direction we need to go in order to really help people attain that independence? Because, Home to Stay can't forever fill that gap. And what we don't want to have happen is that Home to Stay fills the gap for 3 months, 6 months, or whatever, and then it's all of a sudden again unattainable, and people end up back in square one, which is shelter, which we're more than willing to welcome people back. But what are we going to do? And I mean, I don't know. That's why we're having these questions. What are we going to do that helps people aside from, those things that middle-class people understand to do? Middle-class people say get a better job. Middle-class people say get educated. And we definitely want to help people along, but it's multi-level. It's like an onion. It's got all these little layers, and you peel one layer and it might start peeling another one. So, I mean, what are your thoughts on that?
Well, it's really interesting. I have a couple of different thoughts about that. The first is that one of the things as a community that we need to do, and I believe the local planning body is concentrating on, is to create opportunities for more units to be available. That's not an immediate fix. No one's building,
Right. Houses right out.
thousands of units tomorrow that are going to be ready. But long term, that has to be part of the solution. In the short term, when we think about like individuals and individual families that are using our services, we really have to kind of come at it in a couple of ways. The first is, what is sustainable and actionable for this person in this family?
Sure.
Because what the answer to that for you and the answer to that for me would be different.
Sure.
And then when you think about someone that we're providing services for on a regular basis, the gap between what they learned as a child and what survival skills they've created as an adult,
Right.
and what we might think of as thriving is pretty big. So as a community, and I think we do a good job. I really think we do a good job of this. Really need to look at this whole individual and this whole family and find ways to raise their protective factors as a whole.
Get them out of crisis
Get
mode.
them out of crisis and look at stability kind of long term. So I'm going to share a story if that's okay.
Please.
And this is a young man that I had met right in the next room over there in your soup kitchen. I don't know if you remember. When I first arrived here, you invited me over for lunch, and we had lunch there. And I met a young man who was very popular, very engaging, and everyone was paying attention to him. And I also was fascinated with him. And a couple of weeks, maybe a couple of months later, I ran into him at Project Community Connect.
Okay.
And so he sat down across from me. I was at the registration table, and he started kind of just telling me his story. And he was staying here at the time. And his question to me was, I don't understand why I'm homeless. Can you help me understand? And so I asked him to just tell me your story. And as he began to talk, he had shared with me that he had 2 full-time jobs and he had a part-time job on the weekends, and he was in the process of interviewing for a 4th job. And he was making X amount of dollars, and he didn't understand if he felt like, I'm doing all the right
Right, like I
things.
should
Why am I in this situation? And the more we talked, he also shared with me about this car that he had recently purchased. And it wasn't a car that you or I in his situation probably would have purchased because we would have been able to kind of weigh that a little differently. And without judgment, I said, tell me why you picked this car. It was a really nice car. And he said, I picked this car because in my family, you need to think about a car that can get you back and forth to work. And you need to think about a car that you can live in if you have to. I didn't learn that as part of the responsibility of owning a car. And you didn't either,
Oh.
right? So, that's a generational
Sure.
lesson that he learned, that he was unbalancing himself in terms of income and debt to meet
Sure.
as a safety net.
Right.
And because he was doing that, that was leading to him needing the safety net.
Exactly.
So that's the kind of thing where I think if we look at individuals and we look at families and we really think about what their own protective factors are and listen to their stories, then we can help with maybe some education, some like financial literacy, and sort of alter paths a little bit. The great
Absolutely.
ending of this story is that he is in an apartment.
Awesome.
He only has 2 jobs, one full-time and one
Up
part-time
the
job.
car.
He does have a different car now, and it's one
Practical.
that's a little more practical based on his income. So I share that story just as an example of we bring so many lessons to the table with us as adults, and not all of them are lessons that are helpful.
And I think that's where, for us especially, and I know for Home to Stay too, knowing the person, getting to know people by name, getting to develop that balance of trust with them that they can tell their story. And so that story from that young man might not have seemed off at all. Where, for you, it goes ding, ding, ding. That's the issue. Where for him, it was that he didn't understand that that was the issue.
At all.
And, so for us to be able to look at the whole person, not just, oh, all we need to do is get a roof over your head, but it's understanding how do you balance your finances, not just where they come from, what do you do with it? And some of the stereotypical things that we look at are, if you've got a pocket of money and most of that is going toward lottery tickets, or a lot of it is going towards budget, it's like, how do we balance those things? Maybe you want to play the lottery once in a while, or maybe you need to limit your cigarette consumption or whatever so that we can balance this out. Because nobody is asking you to throw all of those things that are your safety nets away.
Right.
We're just asking you to try to figure out how to balance it out a little bit, whether it's um, medical needs, making sure people are getting to the doctor, making sure people who do have, everybody has an asset, right?
Yeah.
So maybe your asset is going to be you could go to Delta, and because of your age and circumstance, you can go to Delta for free. So how do we get you there? And I think that's where case management is so important, because it's more than just, again, we offer this service. This is what we're going to do. Rubber stamp, you get you out the door. It's that we understand you're a person, and that you have a story, and that story is important and valid, and so are you.
The other thing that is so important about what you're saying is in this case management, right? We all have funder requirements of
Sure.
we have to follow them at this point, this point, this point. We need to go beyond that, and we do. Um, so what's happening beyond this 90-day mark of you're no longer okay, you're going to get financial services from home to stay for 30, 60, 90 days. Well, if we stop case management at that point, what's the likelihood that somebody is going to continue on with their housing action plan without a cheerleader?
Right, for sure.
And the reality for us, and I know this is true for you because we work so closely together, is we are not the heroes of anybody's story. We are a guide. Yeah.
There they go.
Speaking of heroes, and so we do not want to assume the role of hero, and we want to empower people to be their own heroes. And I know you guys feel the same way.
Yeah, because otherwise we don't want to become just another I don't want to say crutch, because that's not the word really, but like you said, we can't be the savior in this situation, and so which allows us to go home and sleep at night, frankly, but it also allows us to know that people have assets,
Yes.
and you can do this, and we want to walk with you through it, and when you stumble, come back. That's our outreach program. And you've met Emily, of course. Emily just is that person who says, "Hi, sorry it didn't go so well. Let's try again."
Let's start over.
So,
One of the things that I find so fascinating about your organization and admire so much is you guys have a great way of utilizing the sort of connectivity of the homeless community.
oh,
And
for
so when
sure.
you have a new program to talk about, or you have some exciting news that you want to share, it's great that you and your staff and your community partners are out kind of banging that drum, but you have such a unique and strong way of getting those connected people in the homeless community to share that information for you. And when it comes from a trusted source like that they trust even more than they trust us sometimes,
Sure.
um, I see real action with that. And I just admire that so much about you and your agency.
Well, and I think that that's a point that we forget, is that doesn't matter who you are, or whether you're homeless or whether you're living over by the country club. It doesn't matter who you are. You have friends.
Yeah.
And the homeless community is very connected, like you said, very friendly with each other. We'll say, like, if I'll say, "Hey, have you seen George?" Yeah, I saw him yesterday, because we haven't seen him in a while. And people know each other, and they look after each other, and they lend each other stuff. And so if we can just help foster that, and help establish the relationships that are, let's add a few more people to that circle who might be helpful in a different way. And what I don't like is that we've got three people who can't care for themselves, and so they're all living together in a storage unit.
Yeah.
What would really be better is, how do we get those three people financially secure so that they can be sharing an apartment?
Yeah.
Because obviously, even for a storage unit, someone's got to be paying for that.
Yeah.
So how do we make sure people, like, if they need their paperwork for SSI, or if they need to figure out, hey, I met someone on the internet who's now my payee. How do we try to pull that back, and help people make choices that are better for themselves, so that we can get them out of that storage unit and into an apartment? And I think that's where that connectivity of the community itself, as well as the partnership connectivity, where if I know someone's living in a storage unit, that how can we work together and help them into a better situation?
Well, one of the other on a related note, one of the other functions of the HARA is to conduct the annual point in time count or PIT count. I really don't like that acronym.
Feels like a weird, yeah.
It's such a weird thing. But so the annual point in time count, for folks that might not know, is also a function of HUD. And that's a night in which we're all across the country, but certainly here in Midland County, we go out and we count folks sheltered or unsheltered who are experiencing homelessness. And so we reach out to our community partners and say, how many folks do you have there? But one of the ways that we were successful last year in a way that we haven't been before is by having a connectedness to some folks within the homeless community who could say, you need to go and look at this park. You need to go look at the bus station. Here are some places where people go. And we hadn't had a lot of success with that prior to last year. So I think, again, that points to, how connected this community is and that there really is a community amongst those who are experiencing homelessness.
Yeah, and I think, if you can do something about getting us not doing the pit count in January, that would be really helpful. I know, right? But that was a question I did have for you because out in Huron County, I believe it was in Huron, they did another pit count in the summer. Is that something that they just did on their own, or is that something that the government is doing it more than once a year?
Uh, right now, it's something that folks sometimes are doing on their own. I know that there's been conversation off and on about requiring a second one. Um, what's interesting here in Midland County and probably in this area of Michigan as a whole, but I only want to speak to Midland
Sure.
County because that's what I know, right?
All right.
Um, you know, at this time of year, when it starts to get a little bit colder, we have a group of folks in the homeless community who migrate. They go down 75 south and they go to 40 in Tennessee and they take that over to the beach in North Carolina.
Mhm.
And then as things warm back up here, they reverse that and come home because this is where they consider to be home. So when we're counting folks, the last Wednesday in January, which is when HUD says we have to
Right,
conduct that search, it's a skewed number
for sure.
because a large uh, portion of our population has gone somewhere warmer.
Well, and you and I know that anyway because as you count people and I count people throughout the year, we had 238 individuals stay with us last year for 12,000 nights of shelter. So we know that the handful of people that we found during that night
Yep.
was not accurate. We also know that during the winter, everybody is going to do the best they can to get out of the weather.
Yep.
So we are going to have more people in storage units, or we are going to have more people couch surfing or whatever. That at this time of year, we have more people sleeping in bus stations and in tents.
For sure.
So, but I know for us right now, men's shelter has one bed. And it's the beginning of October.
Yeah.
So we're a little concerned about what winter's going to look like.
Absolutely.
So the women's shelter has a few more beds. It's a larger facility too. But knowing that this is not, it's not stopping. It's not getting better at the moment. And, we're just really looking for answers while at the same time doing our best to make sure that people are cared for where they are.
Yeah.
So
It's interesting too to think about when you think about people being cared for where they are, the being at capacity like that, right? That has a toll on your resources. It has a toll on your staff. Same thing at our agency and at Shelter House and all of our agencies. And so I always think about as we head into winter and being kind of at capacity, like what are some things we can do for our staff, for the people who are providing these services and direct care and those sort of things? Like, how can we make sure they're practicing self-care?
yes, yes. And funny that you mentioned that because we did get our Citygate, who is the national organization of rescue missions, puts out a monthly magazine. And not but maybe 2 months ago, they had a whole thing on staff self-care and whether that is just being encouraging as directors, whether it's doing special things for the people who work for you, making sure that they're not overworking, making sure they're using their PTO, those kinds of things. Being appreciative, I think, on top of it. And helping people understand, like you said, we can't save the world. We do what we've been called to do, and we do it with compassion and we do it with grace. And we love people for sure. But at the end of the day, I can't save anyone. And so if I wear that on my shoulders all the time, I'm going to burn out a whole lot faster than if I come to understand that it takes this village, right?
Yep.
To work together, to try to care for people, and then to also encourage them to be involved in their own recovery.
I think I love all of those things, and I think that one of the things that we as leaders can do is to model the things that you talked about, using our own PTO, spending spending time with our families when it's appropriate. And it's so easy to get consumed with the desire to do more and be more and help more. Um, to use your own words, it is a calling, right?
Yes.
It is a calling. And so I try to concentrate on, am I modeling the things I want the rest of my team to do?
Word.
And hopefully then they're modeling for their clients the things that equal good self-care.
Yeah. And recognizing that, from a Christian perspective, we feel like God has just given us his grace and mercy. And so who are we to withhold that from other people?
Right. Right.
We have been given such care, and that's why we do this, because we want to care for others as we've been cared for. And like you said, if I'm not acting in that way myself, if I'm not embodying that myself, how do I expect the staff to do that with other people? We have to practice what we preach, I guess, huh?
Yeah. And what's really powerful to think about that too, and the kind of influence that kind of the way it trickles back to the clients. Because, you and I both, because I've seen you do this, I feel comfortable saying this, you and I both do interact directly with the clients that we serve. And that's not always the case that the CEO or the executive director has the opportunity to do that, but we both do. And so I think that's another opportunity for us to be modeling, not only for the clients, but for our staff, uh, uh, let's make sure that not only are you treating this person respectfully, but that you're expecting that they also treat you respectfully in return. There's a limit to uh, how much secondary trauma you can take in a day. And so it's okay to say, hey, Saralyn, I'm going to need to tag team this with you so that you can, I need a break. And I just think about all those things as we go into, as we talked about, go into this season where we're going to be at capacity.
And I think one of the things that came up in some of our homeless training that we did about things like de-escalation, especially, is that idea of I can take the noise, that secondary trauma kind of noise from someone, and I don't have to react to that.
Right.
I can realize that this is something else talking. And I can, what we talk a lot about at the open doors, put pennies in the cup. I can be the extra mile of grace. I can say, I hear you. I'm listening. Let me repeat back to you what you've told me. That doesn't necessarily mean that whatever it is you're reacting against can change. I can't necessarily change the rules because someone doesn't like it.
Yeah.
But I can hear what you're saying, and I can understand that that bothers you, and I can look for another avenue. Because, yeah, like you said, part of giving and receiving respect is not just going to be today, here in the moment. It's going to be when you're looking for that job and you're looking for that house. We had a conversation with a guest not too long ago about appearances. What you do matters.
Yeah.
And so you need to do things like take a shower. You need to do things like launder your clothes. You need to make sure that when you go to look for that job or to look for that house, that the person on the other end isn't going to make initial judgments about you that may then cost you what you're looking for. And, so I think that all of those things are teaching opportunities. And sometimes we have to say things that aren't really pleasant, or maybe they, I wouldn't say to you because I don't need to.
Yeah.
But there are times in which I have to say to someone, don't smell very good. You know, you are a very friendly person. I really like to talk to you. But the reason that when you sit down at lunch and everybody moves this way has nothing to do with who you are. It's that you need a shower. So let's take a shower, you know? So kind of those things that are teaching opportunities, not just for me and, you know, my uncomfortability level right now, but that this opens up doors for you.
Absolutely. You know, it was interesting because just this morning, we had a young man who came in needing some assistance with his rent. And he wasn't yet behind, but he was kind of foreshadowing.
Yes.
Yeah, foreshadowing. I've got this, and this is going to cause me to not be able to pay my entire rent. When he first called and spoke to one of our intake team, he didn't like her initial questions. And they're the same questions that everybody gets asked. Um, and he got really belligerent with her. And she tried to redirect the conversation and say, let's take a deep breath. These are the questions I need the answers to move to the next step. And so he began using profanity. And it's our policy that she give him a warning. You know, if you're going to speak like that, I'm going to end the call.
Right.
And he continued. And so she ended the call. It was enough that she felt like she needed to put this information on my desk to keep
Sure.
this person on my radar. So a couple of days later, he called back and got the same intake person. And she just very quickly said, hey, the last time our call ended this way,
So well.
how can we avoid that? So he got to the step where he came in for a face-to-face intake. Came in for the face-to-face intake, became belligerent with that staff person, started swearing and name calling, and he actually left before anybody could ask it. So today, you know, we waited a few days. The staff called and said, we'd like to try to do this again. You know, let's set up a time. And just so you're aware, my supervisor is going to be present.
Right.
And so he came in this morning and, you know, I went up and I shook his hand and welcomed him into our space. And I just shared, you know, I'm sitting in as part of my observation process, but there are expectations for how you can treat me and the people that work here. And we will treat you with the same kindness and the same respect. And it was a great meeting. And I wonder, in this gentleman's instance, he was pretty young. I wonder if anybody had ever said to him,
These are
"Stop
the
that.
expectations.
Yeah,
Right.
you can't do that."
Right.
And it just felt like maybe this was the first time somebody of some authority had said to him, "Stop that."
And again, you open doors for him. If he learns how to control that, that opens so many other doors.
Absolutely.
And it's small.
It's small.
It's
And it's like an everyday thing, right? So
well, it's one of those things again that I think we had the privilege of being taught those things. And some people don't. And so how do we extend that grace to them to like say, stop that?
Yeah.
So
interesting.
but thank you so much for taking some time to sit with me. I appreciate you. I appreciate what you do.
I appreciate you and I admire you greatly.
Well, thank you. Thank you. So good to see you.
You have a great day.
You too.